All right, hey everybody, Professor Klein back here in the Human Anatomy Lab at Ohio University, and today I want to bring you a video on the hand model. And all right, I am in here with the hand model. I've got my book right here with me too. Awesome book. The Atlas of Anatomy is what we use in this human anatomy course, and it has all the hand muscles right here. So I'm going to use that to teach you guys this as well. First off, we got to put back on this top part. It keeps sliding off, but there it'll say. And what we're looking at here are the 5 different fingers or phalanges. We got digit 1, digit 2, 3, 4, and 5 for the pinky finger. And the first thing to note is that you got a lot of things going to the hand. Down in here, you can see on the thumb side is the radius bone. So this is the radius bone right here. This would be the ulna bone. Posterior compartment, if we flip it on over for a moment, you can see the anterior versus posterior compartments of the forearm with the inner osseous membrane in between holding those bones together. And there's a lot going on in this model. So let's start anterior here, and let's start with all these tendons. So coming down first, this is the palmaris longus. Palmaris longus, that muscle in your body. If you go ahead and pinch your fingers together, you see that tendon sticking out. That is the palmaris longus. Not everybody has a palmaris longus, so try this out. Try to pinch your fingers together, and if you have that, you have the palmaris longus, but if you don't, you're missing a muscle. Fortunately, it doesn't do much in the body, so you're not missing out on much. And if there's a palmaris longus right here, there's got to be a palmaris brevis. That's this one right here. I'm going to hold it in place for you. It'll be way up here. And the palmaris brevis is branching off what's called the palmar aponeurosis, this big piece of fascia right here, real thick piece of fascia, which would be the middle part of your palm. That's what holds everything into your hand itself. So that's where the palmaris longus is actually going to hook. So the palmaris longus does a little bit of weak wrist flexion. See it flex right there. But it also tenses up. If I tense up that palmar aponeurosis, that's also the palmaris longus and the palmaris brevis right here. But let's get rid of this thing already and go deeper, because now we can see the difference between the thenar muscles on the thumb and the hypothenar muscles on the pinky finger, the 5th digit. There's some in between as well, but those are the 2 main compartments of the hand. What holds them together? Well, we've got something called the flexor retinaculum. This right here is the flexor retinaculum holding these 2 muscle groups together. Underneath the flexor retinaculum, we've got a whole bunch of tendons. Anterior compartment coming down. What do we got? Well, first off, we've got the flexor carpi ulnaris tendon coming down to the pinky side of the hand. Jump over to the other side, and we've got the flexor carpi radialis going to this side of the hand. Now those are going to do only wrist flexion. Only wrist flexion, because they stop at the wrist itself. What about these other ones here? I'm going to point to them. We got 1, 2, there's 1 underneath here, 3, and then there's 1 on this side, 4. 4 different tendons. That travel out to the 4 different digits seen right here, digits 2 through 5. These are the flexor digitorum superficialis, and they're going to come out and do wrist flexion as well as finger flexion only at these 2 joints here. We got the MCP joint, your knuckles, and then we've got the PIP joint, this one right in here, not the DIP joint for that flexor digitorum superficialis. Whoa, I know a lot going on in the hand and we're not even halfway there yet, but I just wanted to mention, if you look at your own hand and you bend it like this right here, the knuckles, that's the MCP joint. I'm gonna put what that means on the screen here, metacarpal phalangeal joint. But if I curl up like this and I show you the side, this next joint is the PIP joint. But we also have the DIP joint, and you can flex the DIP by itself, but this is how you have to do it. You gotta come in and hold the other ones and then go like that. So notice how I'm only flexing the DIP, distal interphalangeal joint right here. I'm holding the PIP joint in place. One last one to talk about though, and it's the flexor pollicis longus. Flexor pollicis longus. Let me pop this off just for a second so you can see where these are going. Flexor pollicis longus, well, pollicis means thumb. So this one's gonna go all the way out to the thumb and it's going to flex. See how that thumb flexes right there? That's done primarily by the flexor pollicis longus. Another thing you can see in there are the tendinous sheaths, or the common flexor sheaths. Notice how the tendon is wrapped in something a little bit extra right in what we call the carpal tunnel region underneath this flexor retinaculum. Those are called the common tendinous sheaths right there, common flexor sheaths. All right, back to the muscles here, and let me put this back on because we want to see the thenar and hypothenar muscles here. There we go. And what we're looking at are similar things on each side. So I'm gonna start with the abductor pollicis brevis. Abductor pollicis brevis, that's this one right here. But over here, we also have an abductor digitai minimi. What are those gonna do? Well, they're going to abduct the pinky finger if it's a digitai, or the thumb if it's the pollicis. So abduction is taking the thumb from here and taking it straight out to the side. Same with the pinky finger, taking it to the side like that. That's those muscles, and how they're gonna do that is they're gonna pull it out to the side. So muscles pull. So when you pull down on this muscle, it will pull the finger out to the side. Same thing going on over here with this one. Now the next one in, and I've drawn on some lines so that you can see there's 1, 2, 3 on this side, 1, 2 on this side. So the next one in, number 2 on either side, is gonna be the flexor. Now over here, we've got the flexor digitai minimi brevis right here. And over here, we've got the flexor pollicis brevis. Flexor pollicis brevis, it's underneath the abductor muscle. What are those gonna do? Well, they're called flexors, and they're gonna flex. So I'm flexing the thumb, I'm flexing the 5th digit as well. Now there's one more on this left side here, and this one is called the opponens digitai minimi. So number 3 in here is the opponens digitai minimi, and there's also an opponens over here. You can see it underneath. Might as well take it off and show you the opponens pollicis, which is this one here. So this opponens plus this opponens will do the action of opposition, which is when you bring your pinky and your thumb together. This is opposition with those two muscles. Next up, now we've got a deeper view going on here. But I left out something. I left out that this flexor pollicis brevis right here actually has a superficial head. So this would be the superficial head. But right underneath it, if I take it off, this is the flexor pollicis brevis deep head. Deep head right in there. You guys see that little muscle? That's really going to play a difference because they have different nerve innervations. So remember the difference between superficial head and deep head right here. Now what else can we see? Well, now we can see there is actually a muscle, well, 4 muscles branching off the tendons of the flexor digitorum superficialis. So as these come out, we got these muscles branching off. These are called the lumbricals. The lumbricals, digits 2, 3, 4, and 5 have lumbricals. And what these muscles are going to do are what I call the finger plank. Go ahead and try this at home. It's the finger plank, which means you're flexing at the MCP joint and you're extending at the PIP and the DIP joints right here. That are what the lumbricals do. Back to here. Let's take another layer off here, and the next layer down, we've got a muscle simply just called the adductor pollicis. This muscle right here is the adductor pollicis, but you can kind of see that you got fibers going this way, you got fibers coming down this way. We got a transverse head, this one right here, and an oblique head, this one right here. So transverse and oblique. And what is adduction of the thumb? Well, now we're taking the thumb straight across the hand and we're bringing it to the middle like that. So imagine this muscle pulling this direction. When I say pull, this is what I mean. Imagine if this pipe cleaner right here was that adductor pollicis, this one in the middle. Imagine this pipe cleaner is that. When you pull here, it will pull the finger across. So I'm pulling this pipe cleaner and it's producing adduction of the thumb. Muscles pull, they don't push. Back to here. Let's keep going. And now we can see some muscles even deeper in between what are called the metacarpal bones. So these are the metacarpal bones. You can see the bones down in here, leading out to the proximal phalange, middle phalange, and distal phalange. Over on the thumb though, you only have a proximal and distal phalange. There's no middle phalange here, which means you don't have a PIP or a DIP on the thumb. You just have an IP or an interphalangeal joint. But back here, these are called the palmar interossei. Palmar interossei in between these digits. Now really they're only for digits 2, 4, and 5. Why? Because these muscles will adduct. They'll adduct these fingers. And I'm trying not to move the thumb because the thumb has its own adductor muscle. We already saw that right here. But digits 2, 4, 5. Wait a minute, what about the middle finger? Doesn't it have a palmar interossei? Well, the answer is no. And that's because if I put the hand up to the hand, only digits 2, 4, 5 can go into adduction because the middle finger, it's already in the middle. So if you're already in the middle of your hand, you can't move closer to the middle because it's already the middle. So kind of a tongue twister there, but that's why the third digit does not have a palmar interossei. Okay, what else is going on here? Well, let's flip it posterior. Now we got a posterior view, and we can see a lot of muscles coming down. First up, these four right here are the extensor digitorum. You can see them leading out to the hand and fingers, digits 2, 3, 4, and 5 from this side, extensor digitorum. But notice there's an extra one on your index finger. Now the extensor digitorum is going to extend all the joints, but your index finger, your pointer finger, has the extra ability to point. And that's because it's got an extra muscle called the extensor indicis. So your second digit is really good at pointing like this because it has that extensor indicis muscle. And we have the extensor retinaculum covering these tendons here, extensor retinaculum. We can also see the dorsal carpal tendon sheaths, these darker colors here as it travels under that retinaculum. So much going on in the hand, very complex area. And the thumb is also complex because it has 3 different muscles going to it. Let's point out the 3. We got one up here, we got second one down here, and there's actually a third one down here as well. So 1, 2, 3. Now what are those? Well, the one that is really long is the extensor pollicis longus. Extensor pollicis longus. That's going to extend the thumb back. So if you go from flexed, extend it straight back. And you can see it popping out of the skin right there. That's the extensor pollicis longus. Now there's also an extensor pollicis brevis. It's going to stop a little bit earlier, but it does go pretty far out there as well. It just has a shorter tendon in total, but it's going to do the similar action of extension. The shortest though, and the one that's most lateral, now you can really see it on the side here, point to it with my finger, that is the abductor pollicis longus. Abductor pollicis longus. It's going to abduct the thumb. Well, wait a minute, that kind of sounds like the abductor pollicis, here we go, abductor pollicis brevis, and that's because it does the same thing. One's a brevis, it's shorter. The other one on the side here has a longer tendon coming from the forearm, so that's the longus. Now those 3 that I just mentioned, 1, 2, and 3, those make up what we call the anatomical snuff box. Anatomical snuff box of the hand. That's like if I make this action here, you can see how there's a little bit of a indent in between those tendons. That's the anatomical snuff box. Let me give you a better picture of an anatomical snuff box right now. All right, back up here, and we're finishing out muscles with the dorsal interossei. You can see the dorsal interossei in between all these bones, in between the metacarpal bones. Now, dorsal interossei sounds a lot like the palmar interossei, but the dorsal are on the back of the hand. And dorsal are going to do abduction of the fingers. Abduction, not the thumb. The thumb has its own abductors, and the pinky finger has its own. So just digits 2, 3, 4 are going to have dorsal interossei. But wait a minute, I'm counting 1, 2, 3, 4 muscles. 3 fingers, 4 muscles. Well, the middle finger has 2 dorsal interossei, one on each side, because the middle finger can abduct to the left, it can abduct to the right. So it's got to have 1, 2 just for that middle digit. Well, Professor Klein is getting ahead of himself because there are still more muscles on here. We can see the extensor carpi ulnaris muscle that stops at the wrist on the pinky side, extensor carpi ulnaris, and the extensor carpi radialis longus and brevis right here. There's a longus and a brevis for the extensor carpi radialis. And what are those going to do? They're both going to do wrist extension. Not finger extension, because they don't go to the fingers, but wrist extension like that. Last one for you. Truly the last one, I promise. This one is the extensor digitai minimi. If you look real close, there's an extra muscle going out to the 5th digit, and that's called the extensor digitai minimi. That's going to give you a little bit extra extension with the pinky finger. Like if you were taking a drink, I don't have a teacup but I have a water bottle, and you wanted to be fancy, you stick out your pinky finger and take a drink. You can thank your extensor digitai minimi for that ability to be fancy. Now in between these tendons, we've got some intertendinous connections. You can see these connections right here holding some things together. You can see yellow as the nerves. Let's cover nerves now, because this is a comprehensive video on the hand. I'm giving you everything on the hand here. And this nerve, these nerve branches are coming from the radial nerve right here. And the radial nerve is composed of the posterior cord, from the posterior cord, as well as spinal nerves C5 through T1. I'm throwing a picture on the screen to show you where this nerve would be coming from in the body. Now flip it back over. It gets a little bit more complicated with the anterior side, because we have two different nerves. The first one you can see right in the middle is this median nerve, and the median nerve is going to actually stay superficial as it travels to the hand. So I'm going to put the rest of these back in here, and it's going to stay superficial. Now it's going to do all the thumb superficial muscles. So the two that you can see right here as they pop up on the screen would be the median nerve, but it's only going to do, watch this, lumbricals 1 and 2. So you got 4 lumbricals here. Lumbricals 1 and 2 are going to be the median nerve. Now lumbricals 3 and 4 are going to be the ulnar nerve. The ulnar nerve, the other nerve coming down in here to those two. Now be careful, because the first lumbrical goes to the 2nd digit. The 2nd lumbrical goes to the 3rd digit. The 3rd lumbrical goes to the 4th digit. And finally, the 4th lumbrical goes to the 5th digit. So they're offset by 1 on those. But it's a split. Now, I'm not really a Star Trek fan. I'm more of a Star Wars, Lord of the Rings, Harry Potter fan. But I know on Star Trek, who is it? Spock. Correct me in the comments if I'm wrong. He does the live long and prosper sign right here, splitting his fingers into 2 different sections. Digits 2 and 3 are one section, 4 and 5 are another. That is the split of the lumbricals. I don't know if Spock knew he was splitting the lumbricals when he says live long and prosper, but he was. And that can be a way to remember the split in the nerve innervation of the lumbricals. Okay, well, what else is going on? Well, I already mentioned this ulnar nerve coming down here, but let's see it come down. It's outside the carpal tunnel. Median nerve is inside the carpal tunnel. The ulnar is gonna go to all the hypothenar, all of them, and it's gonna go to these two lumbricals, and it's gonna go deep. What I mean by deep, well, let me pop off these muscles here and pop off this one. And now we can see the ulnar nerve coming across. The ulnar nerve innervates the adductor pollicis muscles, both the transverse and oblique head. And here's the huge distinction. The flexor pollicis brevis deep head is ulnar, but the superficial head is median. There is a difference between that deep head and the superficial head with the nerve innervation.
You can't touch this.
But we're not done yet, because we have the ligaments surrounding each joint here. Mainly we focus on the collateral ligaments on either side of the fingers, but there's a lateral collateral ligament and a medial collateral ligament. How do you know what's lateral and what's medial in the hand? Well, if it's on the side of the finger, and I'm gonna put my probe on the lateral side would be this side here, It's the side facing the thumb, That's gonna be lateral. Now the medial side, this side over here, right here, right in here, this side, and really want to take some time to differentiate medial right here versus lateral, which is the other side. So those are the medial collateral ligaments or the lateral collateral ligaments. And don't hate me for this, but I got one last muscle to show you. It's really detailed muscle, but we learn detail here in anatomy class at OU, so I'm going to show you this detail right now. All right, so you see these ones right here, the flexor digitorum superficialis. Well, these actually come out, and technically these are the flexor digitorum profundus. So I'm going to show it in the book here, because the book does the best job explaining it. And here you can see the flexor digitorum superficialis tendons. But if you were to remove those right there and even right over here, now you can see that we're really looking at the flexor digitorum profundus. But look real close, the superficialis, profundus, they're basically smashed on top of each other. So in this model, it is the profundus up here, but you can see that the superficialis has been cut a little bit below that. What does that really mean? That means the lumbricals are actually coming off the profundus. But where does it really make a difference is way out here. The superficialis tendons are going to split, and the profundus are going to travel straight through that tendon. That's right, a tendon splits and another tendon travels straight through it. So on here, we can't really see that unless we look close into here and we see that split of the flexor digitorum superficialis, and the flexor digitorum profundus comes all the way through. Now the insertions are different. The insertions of the profundus goes all the way to the distal phalange. The superficialis stops at the middle phalange. So what does that mean? Well, that means that the superficialis, it can only flex this joint right here, the PIP, because it stops at the middle phalanx. And the profundus can only flex the DIP because it goes all the way to the distal phalange. So if I wanted to test just the profundus muscle, I would have to hold this PIP joint and just flex the DIP. I did that earlier. Here it is again. This is testing for the flexor digitorum profundus. And to cap us off, let's mention the arteries. We got the radial artery coming down, we got the ulnar artery coming down, and we have the superficial palmar arch, as well as a deep palmar arch and extensions going out to the fingers, all the way out to the fingers, called the digital arteries. The digital arteries right here. You can see them on either side, but over here we got a dorsal arch, dorsal arterial arch going back to the radial and ulnar artery. All right, that's all I've got. I can't show you any more on here because there's nothing left. If you see something on here that I didn't mention, let me know in the comments and I will make another video detailing that detail. But we covered absolutely everything you possibly could in here. And now you're an expert on the hand. Thanks for watching.